Hello friends, welcome to my channel Helping Hand for Nurses. In this video, I have included some of the previous questions you were asked in the RRB Staff Nurse Examination conducted in the year 2019, and this is a part 2 of the video. I have already uploaded part 1. Please watch that video also. So let us start the video. First question, how many union territories have representation in Rajya Sabha? Options A 6, B 4, C 3, D1. Answer is option C3. So as of July 10, 2024, only 3 of India's union territories are represented in the Rajya Sabha. They are Delhi, Puducherry and Jammu and Kashmir. The other 5 union territories have populations that are too small to have representation. So, only 3 of India's union territories are represented in the Rajya Sabha, and they are Delhi, Puducherry and Jammu and Kashmir. As of 2022, India has a total of 8 union territories and 28 states. The union territories of Dadra and Nagar Haveli and Daman and Diu were combined as one single union territory on 26 January 2020. Ladakh was separated from Jammu and Kashmir and created as a separate union territory. So the 8 union territories of India are Ladakh, Jammu and Kashmir, Puducherry, Lakshadweep, Delhi, Chandigarh, Dadra and Nagar Haveli and Daman and Diu, Andaman and Nicobar Islands. So these are the 8 union territories. So coming to the Rajya Sabha is the upper house, or it is otherwise known as second chamber or house of elders, and it represents the states and union territories of the Indian Union. So Rajya Sabha is known as the upper house and is also known as second chamber or house of elders, and it represents the states and union territories of the Indian Union. And Rajya Sabha is called the permanent house of the parliament. Rajya Sabha is called the permanent house of the parliament. The 4th schedule of Indian Constitution deals with the seat allocation of Rajya Sabha. The 4th schedule of the Indian Constitution deals with the seat allocation of Rajya Sabha. And coming to the election process, it involves a method of proportional representation. The Vice President of India is the ex-officio chairman of the Rajya Sabha, and now the Vice President of India is Jagdeep Dhankhar, and the Vice Chairman is the Harivansh Narayan Singh. Coming to Lok Sabha, it is known as the lower house, also known as first chamber or popular house. So Rajya Sabha is known as the upper house, second chamber or house of elders, and Lok Sabha is known as the lower house, first chamber or popular house. And it represents the people of India as a whole. And Article 81 deals with the composition of Lok Sabha. And this Lok Sabha was constituted for first time on 17 April 1952. So when we are comparing the Rajya Sabha and Lok Sabha, the maximum strength of Rajya Sabha is 250, out of which 238 members are representatives of the states and union territories. They are elected indirectly, and 12 are nominated by the president. The current strength of the house is 245, where 229 members represent the states and 4 members represent the union territories, and 12 are nominated by the president. And coming to Lok Sabha, the maximum strength of the Lok Sabha is fixed at 550, out of which 530 members are to be the representatives of the states and 20 of the union territories. The current strength of Lok Sabha is 543, out of which 530 members represent the states and 13 represent the union territories. Next question, the money that is spent to buy assets such as land, building, machines and other equipment is called. Options A. Investment, B. Disinvestment, C. Trade barrier, D. All the above. Answer is A. Investment. So the money that is spent to buy assets such as land, building, machines and other equipment is called investment. Then what is disinvestment? The action of an organization or government selling or liquidating an asset or subsidiary. the action of an organization or government selling or liquidating an asset or subsidiary. It is also referred to as divestment or divestiture. Then what is trade barrier? A trade barrier refers to any regulation or policy that restricts international trade, especially tariffs, quotas and licenses, etc. Next question. Which among the following products are non-biodegradable? Options: A. Polythene bags, B. Food wastage, C. Paper, D. Dead animals. So answer is A. Polythene bags. So polythene bags are non-biodegradable. Biodegradable waste are those substances that degrade or break down naturally. Non-biodegradable wastes are those substances that do not degrade easily. Materials such as rubber, plastic, chemicals, paint plastic fall under the category of the non-biodegradable items. Next question. The Wellington Trophy is related to which game or sports? Options: A. Basketball, B. Horse racing, C. Car racing, D. Rowing. Answer is D. Rowing. So the Wellington Trophy is related to rowing. So we can say some of the games and its important trophies. So first one is hockey, and the important trophies related to hockey are Bombay Gold Cup, Aga Khan Cup, Bainton Cup, Dhyan Chand Trophy, Lady Ratan Tata Trophy, Nehru Trophy, Rangaswamy Trophy, Sindhya Trophy, World Cup, Masters Champions Trophy. Next, badminton. The trophies related to badminton are Malaysian Open, Thomas Cup, Narang Cup, Uber Cup, Challenge Cup. Table tennis, Swedling Cup, Bama Belek Cup, Corbillion Cup. And coming to cricket, there are Dulip Trophy, Irani Trophy, Ranji Trophy, Rani Jhansi Trophy, Wills Trophy, Merchant Trophy, Rothmans Trophy, World Cup, C.K. Naidu Trophy, Ashes Trophy. Coming to chess, there are Naidu Trophy, Limca Trophy, Olympia Trophy. A condition of the inner ear characterized by episodic vertigo, tinnitus and sensory neural hearing loss is referred to as. Options: A. Meniere's disease, B. Otitis media, C. Otosclerosis, D. Nystagmus. Answer is A. Meniere's disease. So the condition of the inner ear characterized by episodic vertigo, tinnitus and sensory neural hearing loss is referred to as Meniere's disease. So Meniere's disease is a disorder of inner ear where the endolymphatic system is distended and is characterized by vertigo, sensorial hearing loss, tinnitus and oral fullness. And otitis media, it is an inflammation or infection located in the middle ear. Meniere's disease is a disorder of the inner ear, whereas otitis media is an inflammation or infection which is located in the middle ear. Otitis media can occur as a result of a cold, sore throat or respiratory infection. Otosclerosis describes a condition of abnormal bone growth. It is a condition of abnormal bone growth around one of the three small bones in the middle ear space called the stapes. And nystagmus, it is a vision condition in which the eyes make repetitive, uncontrolled movements. These movements often result in reduced vision and depth perception and can affect balance and coordination. These involuntary eye movements can occur from side to side, up and down or in a circular pattern. So Meniere's disease is a disorder of the inner ear where it is characterized by vertigo, sensorial hearing loss, tinnitus and oral fullness, whereas otitis media is inflammation or infection of the middle ear, and otosclerosis is a condition of the abnormal bone growth and it is mainly affecting the stapes. And coming to the nystagmus, it is a repetitive uncontrolled movements of the eye. Next question. Which grafting of burn wounds are covered with the patient on skin? Which grafting of burn wounds are covered with the patient's own skin? Options: A. Autografts, B. Homografts, C. Heterografts, D. Xenografts. Answer is A. Autografts. So different types of grafts are there. That is, first one is autograft. What is happening in autograft? graft in the same person from one part of the body to another area. The graft of the same person is taken, that is from one part of the body to other area, and usually done in skin graft, hair transplantation and bone. Then coming to the isograft, isograft is usually done between the identical twins. Isograft is done between the identical twins. And coming to the allograft, it is between different members of the same species, like kidney transplantation, heart transplantation, lung, liver, etc. And coming to the xenograft, it is between two different species like monkey to man. So, four types of grafting is there, that is autograft, isograft, allograft and xenograft. Autograft, this is the same person, that is one part of the body to other area, and isograft is between the identical twins, and allograft is between the different members of the same species, and xenograft is between the two different species. Then we can see types of skin grafts. So there are three types of skin grafts. First one is the split thickness graft. Next one is the full thickness graft. And third one is the composite skin graft. What is split thickness graft? So it is the most common type of skin graft. The most common type of skin graft is the split thickness graft. In this type of graft, the epidermis or the topmost layer of the skin, it is removed along with a little part of the dermis. So what is happening in split thickness graft is the epidermis is removed along with a little part of the dermis. Coming to the full thickness graft, this type of graft is usually recommended for face surgery. So in first face surgeries, we are recommending the full thickness graft. Full thickness graft is usually done in the face surgery. And composite skin graft, this type of graft is used for three-dimensional reconstruction such as the nose. Next question. The surgical removal of the entire eye along with a part of the optic nerve is termed as options A. Keratotomy, B. Enucleation, C. Keratomiliosis, D. Vitreoretinal surgery. Answer is B. Enucleation. So the surgical removal of the entire eye along with a part of the optic nerve is termed as enucleation. So enucleation, it is a surgical removal of the entire globe from the orbit. And evisceration, it is a surgical removal of the entire content of the globe leaving the scleral shell. So enucleation, surgical removal of the entire globe from the orbit, and evisceration, it is a removal of the entire content of the globe leaving the scleral shell. Evisceration, we have already seen that it is a removal of the contents of the globe. And what is happening is that it leaves sclera, fat, extraocular membrane and other adjacent structures of the eye. And coming to enucleation, it is a removal of the entire globe. And it leaves only extraocular membrane and remaining orbital contents intact. And in exenteration, it is a removal of the entire content of the orbit including the extraocular membrane. And what is keratotomy? It is otherwise known as cutting the cornea. It involves making a partial thickness incision into the cornea. Making a partial thickness incision into the cornea to change its radius of curvature and refractive power. And coming to radial keratotomy, it is abbreviated as RK, radial keratotomy. It is a type of refractive surgery meant to correct myopia or nearsightedness. Next is the LASIK. LASIK is a laser in situ keratomiliosis. It is surgery that flattens the cornea. It's the most common laser surgery for correcting nearsightedness or myopia and astigmatism. Next is vitreoretinal surgery. It is used to treat retinal detachment, floaters and flashes and macular holes and puckers. Next question. Large heaped up mass of scar tissue developed and extending beyond the wound surface is known as options A. Keloids, B. Acne scars, C. Contracture scar, D. Hypertrophic scar. Answer is A. Keloids. So keloid scars are the abnormal growth of scar or extended growth of scar beyond the border of the original injury. Keloids may have pruritus and hyperesthesia and have the chances of reoccurrence after the excision. Which cranial nerve is responsible for the sense of smell? Options A. Olfactory, B. Oculomotor, C. Optic, D. Vestibulocochlear. So the answer is olfactory. So the cranial nerve which is responsible for the sense of smell is olfactory. So the table contains cranial nerves and the function related to it. So please go through this chart. Next question. Which is described as a powerhouse of cells? Options A. Ribosomes, B. Norepinephrine, C. Golgi apparatus, D. Mitochondria. So which is the powerhouse of the cell? Yes, it is mitochondria. So mitochondria, it is a powerhouse of cells. Which is the protective membrane covering the brain and spinal cord? Options A. Pericardium, B. Pleura, C. Meninges and D. Peritoneum. Answer is C. Meninges. So the protective membrane covering the brain and spinal cord is meninges, and pericardium it is related to the heart, pleura related to lungs, peritoneum it is related to peritoneal cavity. So the layers of the meninges include, that is from inside to outside, it is pia mater, arachnoid and dura mater. And coming to the heart, mainly the heart contains three layers, that is the endocardium, myocardium and pericardium. So endocardium it is the inner one, myocardium that is the middle one which consists of the muscles, and pericardium it is the outer one. And the pericardium it is further divided into three layers, that is the visceral pericardium, then parietal pericardium and fibrous pericardium. And this visceral pericardium, viscera means organ, that is internal organ which is related to the heart, closely related to the heart. So visceral pericardium, it covers the outer layer of the wall of the heart. And parietal pericardium and the fibrous pericardium, it forms a pericardial sac which encloses the heart. In between the parietal pericardium and the visceral pericardium, there is a cavity which is known as a pericardial cavity. Coming to the lungs, the two layers of the lungs are visceral pleura and the parietal pleura, and in between that there is a space called the pleural space where the pleural fluid is filled. And peritoneum, it is a membrane that lines the peritoneal cavity or the coelomic. Question. Breakdown of glycogen to glucose is known as. Options A. Glycogenolysis, B. Glycolysis, C. Proteolysis, D. Proteogenolysis. Answer is A. Glycogenolysis. So the breakdown of glycogen to glucose is known as glycogenolysis. ATP, that is adenosine triphosphate, is an inorganic substance which is required to provide energy to the living cells in order to carry out so many activities. So when the cell detects low ATP level, then what is happening is that the glycogen is liberated from the muscles and liver and it is broken down into glucose, and that glucose is later used to produce ATP, that is the adenosine triphosphate. So glycogenolysis is a metabolic process that converts glycogen from muscles and liver to its monosaccharide form, that is a glucose. That is, the glycogen is broken down into glucose 1-phosphate and glycogen during glycogenolysis. So it occurs in the cytoplasm of cells in the liver, muscles and adipose tissue. Glycogen phosphorylase and phosphorylase kinase activated by phosphorylation are the two main regulating enzymes of the glycogenolysis. So two main regulating enzymes of the glycogenolysis are glycogen phosphorylase and phosphorylase kinase. Then what is glycolysis? It is a process in which the glucose is broken down to produce energy. That is, glucose is broken down to produce energy. So it produces two molecules of pyruvate, ATP, NADH and water. This process takes place in the cytoplasm of a cell and does not require oxygen. So it occurs in both aerobic and anaerobic organisms. And it is a primary step of cellular respiration. Primary step of cellular respiration which occurs in all organisms. So glycolysis is followed by the Krebs cycle during aerobic respiration. So the end products of the glycolysis is 2 pyruvate, that is 2 molecules of pyruvate, 2 ATP and 2 NADH molecules. What is proteolysis? It is a breakdown of protein. Lysis means breakdown. So the breakdown of the proteins into smaller polypeptides or amino acids. Next question. Which hormone increases the blood pressure by constricting arterioles during severe hemorrhage? Options A. Oxytocin, B. Antidiuretic hormone, C. Follicular stimulating hormone, D. Luteinizing hormone. Answer is B. Antidiuretic hormone. Antidiuretic hormone is secreted by the neurohypophysis of the pituitary gland. Since it stimulates the construction of blood vessels and results in an increase in blood pressure, therefore it is called a vasopressin. So antidiuretic hormone is also known as the vasopressin. Next question. The preterm infant's elbow may easily brought across the chest with no resistance ease. Options A, grasp reflex, B, sunset sign, C, scarf sign, D, tonic neck reflex. Answer is C, scarf sign. Next question. Hernial protrusion of a sac-like cyst of meninges filled with the spinal fluid is known as. Options A, meningocele, B, meningomyelocele, C, encephalocele, D, rachiticus. So the answer is meningocele. Myelo means spinal cord. So what is happening in meningomyelocele is that along with the meninges, there will be protrusion of the spinal cord will also occur. So in the question, it is a hernial protrusion of the sac like cyst of meninges which is only filled with the spinal fluid. So the answer is meningocele. And meningomyelocele, what is happening is that along with the meninges, spinal cord will also be protruded. So these are some of the terms related to the neural tube defects. Craniorachiticus, there will be completely open brain and spinal cord, and anencephaly, open brain and lack of skull vault. Encephalocele, there is a herniation of the meninges, and in encephaly it is a occipital skull and spine defects with extreme retroflexion of the head. And spina bifida occulta, it is a closed asymptomatic neural tube defect in which some of the vertebrae are not completely closed. Closed spinal dystrophism, that is deficiency of at least two vertebral arches, here it is covered with a lipoma. And meningocele, protrusion of the meninges filled with the CSF through a defect in the skull or spine. Myelomeningocele, that is an open spinal cord with a meningeal cyst. Urethral opening located below the penis is known as. Options A, epispadias, B, phimosis, C, hydrocele, D, hypospadias. Answer is D, hypospadias. So the urethral opening located below the penis is hypospadias and above the penis is epispadias. Hypospadias and epispadias. Phimosis defined as the inability to retract the skin covering the head of the penis. Hydrocele, it is an abnormal collection of serous fluid between the two layers of tunica vaginalis of testis. Next question. What is the average weight gain of the neonate per day? Options A, 5 to 10 grams, B, 25 to 30 grams, C, 50 to 60 grams, D, 100 to 150 grams. Answer is B, 25 to 30 grams. So in the first few months, babies gain about 1 ounce, that is 28 grams per day. That slows at around 4 months to about 20 grams a day. As they turn 6 months old, many babies are gaining about 10 grams or less a day. Next question. In which condition the phototherapy is used for the treatment? Options A, cyanosis, B, jaundice, C, diarrhea, D, ischemia. Answer is option B, jaundice. Next question. How much population is usually covered by community health center? Options A, 30,000 to 50,000, B, 50,000 to 70,000, C, 80,000 to 1,20,000, D, 1,20,000 to 1,90,000. Answer is C, 80,000 to 1,20,000. So in the table you can see that the subcenter covers a population of 5,000 in plain areas, and in hilly areas it is 3,000. So it usually we can say that it is 3,000 to 5,000. And coming to PHC, it covers population of 30,000 in plain areas and 20,000 hilly areas, that is 20,000 to 30,000. And CH, that is a community health center, it covers a population of 1,20,000 in plain areas and hilly areas in 80,000, that is 80,000 to 1,20,000.